If you have ever noticed a pimple appearing in the exact same spot on your face multiple times, you have probably assumed it was just bad luck or a coincidence. Maybe you thought you had not cleaned that area well enough, or that you had touched your face without realizing it. But recurring pimples in the same location are rarely random. And they are rarely simply a matter of hygiene or carelessness. There is almost always a specific biological explanation for why a particular follicle in a particular spot on your face keeps becoming problematic, and understanding that explanation changes the way you think about treating and preventing those breakouts entirely. To understand why pimples recur in the same spot, it helps to start with what actually happens inside the skin during and after a breakout. Every pimple originates inside a hair follicle, a small tubular structure that extends from the surface of the skin down into the deeper layers. Attached to each follicle is a sebaceous gland, which continuously produces sebum, an oily substance that keeps skin moisturized and protected. When dead skin cells and excess sebum accumulate inside the follicle faster than they can be cleared, they form a blockage. Depending on whether the follicle opening stays open or closed, and whether bacteria become involved and trigger an inflammatory response, this blockage can develop into different types of acne lesions ranging from a simple blackhead to a deep, painful cyst. What most people don't realize is that a breakout doesn't necessarily end when a pimple disappears from the surface. When a significant inflammatory pimple resolves, the follicle that housed it has been through a meaningful amount of biological stress. The inflammation associated with a moderate to severe pimple can cause microscopic damage to the walls of the follicle itself, and this damage changes how that specific follicle functions going forward. A follicle that has been inflamed and damaged is more prone to abnormal cell shedding, irregular sebum accumulation, and repeated blockage compared to a follicle that has never been significantly inflamed. This is one of the primary reasons why a pimple tends to recur in the same location. The follicle in that spot has been structurally altered by previous breakouts in a way that makes it more vulnerable to future ones. This cycle is particularly pronounced with deep, painful pimples that never fully come to a head at the surface. These deeper lesions, sometimes called blind pimples, nodules, or cystic acne depending on their specific characteristics, sit well below the skin's surface and involve significant inflammation deep within the follicle. Because they are so deep, they often don't resolve as cleanly as more superficial breakouts. Even when the visible inflammation subsides and the skin looks clear on the surface, there can be residual material, scar tissue, or a partially damaged follicle wall remaining beneath the surface. This residual damage creates the ideal conditions for the same follicle to become blocked and inflamed again, sometimes within weeks of the previous breakout appearing to resolve. People who experience this pattern often describe it as feeling like the same pimple keeps coming back, and in a biological sense, that description is fairly accurate. Squeezing or picking at pimples, particularly deep ones, significantly worsens this cycle. When external pressure is applied to a pimple in an attempt to force it to the surface, several things can happen that increase the likelihood of recurrence in the same spot. The contents of the follicle can be pushed deeper into the surrounding tissue rather than cleared upward, which triggers additional inflammation in a wider area around the original lesion. The mechanical force of squeezing can tear or damage the follicle wall, creating scar tissue that permanently alters how that follicle drains and clears sebum, and introducing bacteria from the fingers into an already inflamed follicle can extend or intensify the inflammatory episode, causing more damage to the surrounding tissue. Each of these outcomes makes the affected follicle more structurally compromised than it was before the squeezing occurred, which directly increases the probability of a recurrent breakout in that exact location. External friction and pressure on specific areas of the face is another significant and frequently overlooked cause of recurring pimples in predictable locations. This category of acne has a clinical name, acne mechanica, and it refers specifically to breakouts triggered by repeated mechanical force on the skin rather than primarily by hormonal or internal factors. The mechanism involves repeated compression or friction disrupting the normal shedding of cells from the follicle wall, causing those cells to accumulate inside the follicle and eventually create a blockage, because the friction tends to come from a consistent source of phone pressed against the cheek. During calls, a hand resting under the chin while sitting at a desk, glasses frames resting on the nose bridge, a sports helmet strap against the jaw, or hair repeatedly falling across the same area of the forehead, the resulting breakouts tend to appear in the same location every time, following the exact pattern of whatever contact is causing the irritation. This explains a pattern that many people find confusing: breakouts that appear specifically on the side of the face where they hold their phone, recurring pimples exactly where glasses sit on the nose, or consistent forehead breakouts in the specific area where bangs or hair falls. These aren't coincidences, they reflect a direct relationship between a repeated mechanical trigger and a follicle response in exactly the area being affected. Identifying the source of friction is the critical first step in addressing this type of recurring breakout, because without removing or reducing the mechanical trigger, the cycle will continue regardless of how many topical treatments are applied to the affected area. Hormonal fluctuations add another layer of explanation for why certain spots on the face are prone to recurring breakouts, particularly along the jawline, chin, and lower cheeks. These areas of the face have a higher density of sebaceous glands that are particularly sensitive to androgens, a category of hormones present in everyone. At different levels, when androgen levels fluctuate due to a monthly hormonal cycle, stress-related cortisol changes, or other hormonal shifts, sebaceous glands in these androgen-sensitive areas respond by temporarily increasing oil production. This surge in sebum production increases the likelihood of follicles in those specific areas becoming blocked during the period of hormonal elevation. Because the same areas of the face are sensitive to these fluctuations every time they occur, breakouts tend to cluster in the same locations month after month, following a pattern that can be remarkably predictable once someone starts tracking it. Stress deserves specific mention as a contributing factor that is often underestimated. When the body experiences stress, cortisol levels rise, and cortisol has a documented relationship with increased sebum production and inflammation, both of which contribute to acne formation. But the reason stress-related breakouts tend to appear in consistent locations rather than randomly across the entire face comes back to the same principle. The follicles that are already most vulnerable due to previous damage, androgenic sensitivity, or mechanical irritation are the ones most likely to respond to the additional sebum and inflammation signal that stress creates. Stress doesn't randomly select a new location for a breakout, it tends to tip the most susceptible follicles over the threshold into a full inflammatory episode, which is why stress-related breakouts so frequently appear in the same spots as previous breakouts. Sleep position is another factor that doesn't get nearly enough attention in conversations about recurring facial breakouts. People who consistently sleep on one side of their face are pressing that side against a pillowcase for several hours every night. Pillowcases accumulate sebum, dead skin cells, hair products, and bacteria over time, and repeatedly pressing this material against the same area of the face creates both a mechanical friction component and a bacterial transfer component that can consistently irritate the same follicles night after night. This helps explain why some people notice their recurring breakouts are predominantly on one side of their face, the side they sleep on, while the other side remains relatively clear. Changing pillowcases more frequently or switching to a different fabric can sometimes produce a noticeable change in this specific pattern of recurring breakouts. Hair and hair products are another commonly overlooked source of recurring breakouts in predictable locations, particularly along the hairline, forehead, and temples. Hair products including styling products, conditioners, and oils can transfer from hair to skin and clog follicles in whatever area the hair makes consistent contact with the face. This is sometimes called pomade acne, though it applies to a wider range of hair products beyond just pomades. People who wear their hair in ways that allow it to fall consistently across specific areas of the forehead or cheek often notice that their recurring breakouts cluster in exactly those areas, and that changing how they style their hair or switching to different hair products produces a corresponding change in where breakouts occur on their face. Understanding all of these contributing factors reveals why recurring pimples in the same spot are so difficult to resolve by simply applying more topical acne treatment to the affected area. Topical treatments can address the symptoms of a breakout as it occurs, but they don't automatically remove the underlying reason why that specific follicle is more vulnerable than others. A follicle that has been structurally damaged by previous breakouts will continue to be more prone to recurrence regardless of how much salicylic acid or benzoyl peroxide is applied to the surface above it. A follicle that is repeatedly irritated by friction from a phone or glasses frame will continue to be triggered by that friction regardless of how diligently topical treatment is used. A follicle in an androgen-sensitive area will continue to respond to monthly hormonal fluctuations regardless of topical treatment alone. This is why dermatologists often approach recurring breakouts in the same location differently from more generalized acne, rather than simply increasing the strength of a topical treatment. A dermatologist evaluating this pattern would look at the full picture, the specific location and pattern of recurrence, the characteristics of the lesions themselves, surface versus deep, inflammatory versus non-inflammatory, the patient's hormonal history, lifestyle factors including sleep position and phone habits, and any hair or makeup products that might be contributing to identify which specific factors are most likely driving the pattern in that individual case. Treatment approaches might then include addressing the hormonal component through medication, recommending changes to habits that are causing mechanical friction, adjusting the skincare routine to avoid products that are contributing to follicular blockage, or using targeted treatments designed specifically for the type of lesion involved, rather than a generic approach. For people dealing with this pattern, a few practical starting points are worth considering before seeing a dermatologist. Tracking breakouts, noting when they appear, where exactly they appear, and what might have changed in the days before they appear, stress levels, hormonal timing, changes in sleep position, new products, increased phone use can reveal patterns that make the underlying cause much clearer. Cleaning phone screens regularly, changing pillowcases more frequently, and being mindful of consistent facial touching habits can address mechanical triggers without requiring any product changes. Avoiding squeezing or picking at recurring lesions, however tempting it might be, is particularly important specifically in recurring spots, since additional follicular damage in an already compromised location consistently makes the recurrence cycle worse rather than better. For recurring deep or cystic lesions in the same spot specifically, seeing a dermatologist is generally the most effective path forward, since these types of lesions are particularly prone to the follicular damage cycle that drives recurrence, and they often respond better to prescription-level treatment approaches than to over-the-counter products. A dermatologist can also evaluate whether there is a hormonal component worth addressing, particularly if the recurring breakouts follow a predictable monthly timing pattern or cluster in the jawline and chin area, since addressing the hormonal driver directly rather than just treating each individual breakout as it appears tends to produce more lasting results. Ultimately, the reason a pimple keeps coming back in the same exact spot is almost always a story about a specific follicle that has become more vulnerable than its neighbors, for reasons that are biological, mechanical, hormonal, or some combination of all three. Recognizing that recurring breakouts in the same location are telling you something specific about that particular spot on your face rather than representing a random pattern of bad luck is the first step toward addressing the actual cause rather than just repeatedly treating the symptoms as they appear.